Long-term care facilities are asking for more help from the state as more patients and workers test positive for the virus. Teresa Priolo shows us how those who rely on these services feel as if they're becoming more and more vulnerable.
I just lost a staff from ADAPT that I knew very well, that she was like a mom to me, and she died from the coronavirus.
Each day, as New Yorkers scroll through the tally of the sick and the dead, lies the shocking reality those with developmental disabilities are getting hit by this virus and hit hard. Queen lives in a long-term care facility run by the ADAPT We Care organization.
The staff I lost, I'm going to miss her a lot.
To date, at least 5 people in the ADAPT group have died. Roughly 16 staffers are in quarantine. The New York chapter of ARC has lost 10 people. According to a local consortium of long-term care groups, disabled New Yorkers are nearly 5 times more likely to contract, become hospitalized, and die from COVID-19 than the general population. Part of that is due to underlying conditions, but it's also due to lack of equipment, the inability to isolate, and reduced staff.
Between staff reluctance, staff being sick, and some of our individuals coming down with the virus, and some of them quite deathly ill, it's been a real challenge for us.
Ed Matthews is CEO of ADAPT.
Quite frankly, some people have died, I think, in some of the group homes because we didn't have protective equipment, and we didn't have ways to deal with people bringing in the disease.
Roughly 50,000 New Yorkers are cared for in long-term facilities. Matthews has been lobbying the state office of people with developmental disabilities and the governor for additional resources, including more PPE, hazard pay, and access to a hospital when the resident is admitted. One such person would be DARRYL Lewis, an ADAPT veteran.
They know what a smile means. They know what a frown means. They know if they blink their eye twice, or if they move their mouth a certain way, or move their hands because they can't communicate as well. They know what that means.
Everybody we talked to said they believe the governor is doing a great job handling the crisis. They just hope that disabled New Yorkers become more of a priority. We reached out to the state for comment, but haven't heard back. Teresa Priolo, Fox 5 News.